Hi, I've done a few MCQs for doctors, and this is an MCQ pattern for parents. So this is the first in the MCQ series for parents. Of course, it will be useful for medical professionals as well, as these points will be useful for your practice. So which of these statements is not correct about cough in children? So this is a very important problem. Persistent cough can be associated with wheeze or asthma. Cough is a protective airway response and ideally it should not be suppressed. Honey and lemon can help to reduce irritant cough in kids. Any cough in a child should be treated as it can be harmful. Cough suppressants can be sedative and it can cause constipation. Nasal block or obstruction can increase cough. So there is only one choice which is not correct, and I want you to pick that. I'll pause for a second. You can also pause the video on your device to get more time to read and think about the choice. So now I'll discuss the response. So persistent cough may be associated with wheeze or asthma, or rather asthma is one of the causes of persistent cough in children. So this is correct, but not every persistent cough has asthma or allergy as a predisposing factor. So you need to discuss with your doctor when cough is persistent. Sometimes it may be just a series of recurrent viral infections when this child has started school, for example. And young kids may have viral related wheeze, which can cause this persisting cough and mild wheeze as well. The second point is very true. Cough is a protective airway response, and ideally it should not be suppressed. So cough is a protective response. Suppose we are choking on something, the cough tends to bring it out. And when there is infection irritating the airways, it is an irritating symptom, but obviously it's trying to clear the secretions. And the secretion staying in the lung can increase the risk of infection staying or becoming worse, like a pneumonic change. And so the coughing keeps the chest clear, and it's not to be suppressed ideally. One of the common remedies, honey and lemon, can be used. Honey, of course, should not be used in kids below 1 year of age. And after 1 year of age, you can use either honey alone in small doses or honey lemon mixed in a lukewarm water. The latter is preferred because honey alone is very sweet and obviously high calorie as well. You can give it to the child to keep sipping, and lukewarm temperature helps as well with the soothing effect on the throat. Any child having cough should be having treatment, as it can be harmful. So any cough in a child should be treated. So this is the incorrect statement. It's obvious from the previous points that cough is a protective reflex and you should only treat it if it is really frustrating, and or if there is an underlying problem like wheeze or nose block, which can be treated. So ideally try to tolerate the cough and do things which can reduce the cough, like giving sips of water, having a comfortable room temperature. A cold air which is going into the baby can be irritating, and you can adjust the posture of the child. Avoid overeating when you have cough so that the reflux doesn't aggravate the cough. The next point is about medications used. Cough suppressants are very rarely used in children. Even if the parents insist, we can try to resist that and discuss with them why. Cough suppressants can be sedative, and that they can also cause sluggish gut motility and cause constipation. So they're not ideal medications, and better not to use them if at all possible. If you have it prescribed, you can use it just occasionally when it really gets worse. And nasal blockage or obstruction can increase the cough. So this is a very important point to remember, because this is one of the tools that can help you manage the cough. Nose block makes the child breathe through the mouth. And what happens here is that you're losing the humidification effect from the nose. The air which is going in normally gets heated and humidified through the nose, but when you're breathing through the mouth, that humidification and heating effect is lost. So the cold air actually reaches the back of the throat, and this irritates the child and causes significant cough. So clearing the nasal obstruction is one of the most important steps you can do. It's safe using saline drops. Very rarely, if it's severe, you can use medications like Otrivin drops above 1 year of age preferably, and this should not be repeated more than 3 to 5 days. Use it just at bedtime if needed. So this is one important management measure, keeping the nose open, position which is suitable, avoiding extra food or overeating or extra liquids, Keep giving small sips of water but not large volume at one go, because the reflex also can aggravate the cough, and when you're coughing the abdominal muscles are contracting, so reflex is very likely. So many children vomit after a cough due to the same reason. So these are very important tips, and some of you had requested management of cough in older kids because I have shared the one on infant care, so you can assume this is the one for cough for older kids. I hope it helps. Thank you.